I think. Oh my God.
Hello, welcome to Local Matters. My name is Vicki Evans. The state of the well-being of Arizona's children is a gauge to the quality of our own future. So let's learn more about the future of our children and those, those futures, or that future for our state. And we're going to learn more as we welcome Penelope Jacks. Penelope, thank you for being here.
Glad to be here.
And Penelope is the director of the Southern Arizona office of the Children's Action Alliance. And we welcome Colleen Bagnell. Colleen, thank you for being here. And Colleen is the development director of Child and Family Resources, Inc. And Penelope, tell us about how would you describe the state of well-being of Arizona's children?
Unfortunately, I wish I could say something good. In the last 10 years, we've made significant strides in a whole range of areas for children.
And can you just mention some of those ranges?
Sure.
And talk about, people laugh, we laugh amongst ourselves as citizens in kind of that hollow way, because we rank so continually at the bottom when it comes to how we treat and care for our children.
Well, a couple good things. One is we had moved up in the rankings altogether. We'd made significant improvements in the rate of teen pregnancy. We'd made significant improvements, very big improvements, in the rate of uninsured children. We have very much changed and improved how we deal with neglected and abused children. So things were actually looking up, and a lot of hard work on the part of a lot of legislators, the governor, advocates, really was paying off. And I think we're about to reverse that basically in the blink of an eye. So I think the work of a huge number of committed people is about to be undone by the legislature in the face of this budget that they've proposed and the one they've just passed.
And it's just basically taking money away that finance these
taking money away
healthcare.
That amounts to laying off workers in every preventative area. If we keep on the rate we're doing, we'll have no preventative services in Arizona.
And either of you, what is the ripple effect of that?
Well, I can speak from Child and Family Resources. We're a nonprofit agency. We help 38,000 people and their children and families across the state. And we're touching those lives and making a difference. We're preventing child abuse and neglect. And I'll give you an example of that. One of our programs, it's called Healthy Families. And we're in the hospitals. And, new parents are always nervous. But we seem to find those parents who tell us that I'm nervous for this reason. I was abused or neglected as a child, and I want to be a parent, but I want a new way of dealing with my child when he or she cries. And this is what I've learned from my parents. I want something different. So we go into the home and we work with that parent. What do you do when you're so stressed out and the baby's been up all night? What do you do when you have to go to work and you've had 2 hours sleep? How do you deal with that stress? How do you discipline a child? Do you spank a child? All of these things we're going over with them in the home, through home visitation, through workshops, and we follow that child for 5 years. So there's a child that could be at risk for being abused or neglected, but we're there for those first 5 years before the child goes to school to watch them.
Right.
And what that means is that child will not wind up being taken away, taken out of the home.
And again, that's more money
care.
For the taxpayer when a child is removed.
It's
and the it's just
money.
huge, isn't it?
It's so much worse for the children to be taken. There aren't foster care homes even. And now with the cuts, basically, DES has laid off so many staff that they won't even be able to investigate all the reports of child abuse. So those they investigate, they have no services to offer, so they will either leave the child in the setting or put them in foster care, which doesn't exist.
Right. So Children's Action Alliance is an advocate.
Yes.
On what levels? Legislative, obviously, but tell us what it is the
We
organization
focus
does.
primarily on the state legislature, but we also work a little bit at the city, at the county, and at the federal levels. And those things are so interactive that you can't really separate them out. And particularly as the federal stimulus money comes in, we want to make sure that Arizona gets its share and uses its share for the purposes that it was meant for.
Which way is that money coming in? Is it coming in through health allotments? I know,
Yeah.
Or
a lot of it is coming in for focus on health, for people who are losing their health care because they've been laid off from their jobs. And they've also raised the amount of federal dollars for the state match. So it's an incredible bargain. Aside for the state, it brings in a lot of federal money, and it also provides health care for people who would be losing it.
Right now, Colleen just described what Child and Family Resources is doing in the one particular place about helping young parents and parents with very small children. would education dollars, could stimulus education dollars come through?
Yeah, we also have a teen parent program where we help them get their GED and high school diploma. So some of that money could be used. We have city funding right now that, as you know, is at risk of being cut. And our particular program, we have a stipend of $60,000 from the city. If they took that away, the program, it's called the Center for Adolescent Parents, would end. And these are, young girls who say, I want to make a difference. I've made this choice in my life, and I'm accepting responsibility. I'm not having somebody else raise my child. I'm going to get my GED or high school diploma. I'm going to get a job that's more than minimum wage, and I'm going to go out there and make a difference. And quite a few of them go to Pima Community College to further their education. But if they don't have us helping them through that process, it's not going to happen. So for the $60,000 you may lose from the city, they're going to have to pay a whole lot more because those girls are going to need benefits.
It's the girls, it's their children, it's the drain on our own. I mean, it just goes on and on.
And it's the cycle because so many of them, their parents are having babies at the same time they are. They're young moms. They're 14, 15, 16. So mom says, oh, I have my own child. You're on your own. And so where is she on her own? Who's going to take care of her? And most importantly, who's going to take care of that child? And that's who we have to look out for because with teens, they're at risk of poverty, domestic violence, substance abuse, alcohol abuse, and it's just a cycle. It's a cycle of poverty, and that's what we're trying to stop.
Cycle of poverty, right?
And we know that every bad thing that affects children tracks poverty. That's the primary indicator. So if you can move these girls into a place where they can support their children at a much better level, everything looks a lot brighter. But another example of the stimulus money that you were talking about is that came in was for child care subsidies. Parents across the state got letters last week, a week before, I guess, saying your subsidy for child care is going to be ended in 1 week. And for that, it just affects a huge number of people. People were already saying, I can't go to work. I can't leave my 5-year-old or my 4-year-old or my 3-year-old at home.
And it's cheaper for them to not work.
Yep.
Because
if they have
child care costs so much, so if they have to pay that much. So now you're putting people on welfare rolls when they really want to work. So we really are putting them in a bad position.
So the stimulus money, luckily the governor accepted the stimulus money in a timely fashion. The legislature acted in a timely fashion so that some of the people who were going to be cut off of the child care subsidy had their benefits restored. So that's a great thing. There is still a growing waiting list for child care benefits, and that is not being helped by the subsidy. So that, but that we expect by June there'll be 5,000 people on a waiting list. And it's a waiting list. You usually think, one person goes on, a new person comes off. This is a wait forever list. This is not one where if a person goes off, another one comes on. It's a waiting list with no end.
Right. And in the meantime, the make do is, as you said, either don't work or who knows, or the child goes to maybe a place that's not the best or a person that's not the best.
There's, kids go to substandard child care. And I think the thing that worries me most is people keeping their elder child home to take from school every other day to watch their little one.
Right.
So, I mean, when you were talking about the ripple effect, there is a horrible
Exactly.
ripple.
Or even grandparents who are very ill who really shouldn't be watching little 2- and 3-year-old children. That's the only place they can go. So they figure it's safe, but we all hear those stories of the boyfriends watching the child and somebody falls asleep on the couch and the child's in the pool.
Right.
I mean, we hear that already. And just think of how that's going to change.
Right, right. Well, this is a good time. We've talked a little about Children's Action Alliance and also Child and Family Resources. But what are the differences between the two organizations? We've talked, your advocacy and so on, and obviously services. So what else?
I think that is the big difference, that we don't actually see children. We see legislators. And so we work to make policy that is positive for children. But once that policy in place, we leave it to organizations like Child and Family Resources to make sure that that actually happens on the ground. Is that right?
That's right. And about a month ago, we had a rally, and we wanted to put a face behind those cuts. And when you see there's a child who has a developmental disability, so this is a child who has cerebral palsy or autism, and you've taken that funding away. So that parent can't go anywhere in the city, really, because everybody got cut. So when you started to see who those people were and those little faces, I think that put the face on this decision by the legislature. And we can't forget that, because you work with lawmakers, I work with families.
Right, right. So we want you to know some information about Child and Family Resources and the Children's Action Alliance. So let's take a look. Children's Action Alliance, and you can always email Penelope at pjax. You have one of the longest emails.
I know, it's horrible, isn't it?
pjax@caa. Oh my gosh. Go ahead.
TUCCOXMAIL.com.
Okay. And I'm trying to make a word out of it, which I don't think I'll say out loud, you know. But again, the website's very important, and it's azchildren.org. Again, the Children's Action Alliance, azchildren.org. And then for Child and Family Resources, and your organization, Child and Family Resources, has really been helping out for quite a few.
You know what? Next year's our 40th anniversary.
Wow.
And we started in Tucson. That's our main headquarters still today. And we're in 6 other cities across the state. And especially in areas like, Douglas, Nogales, Sierra Vista. In Douglas, we're the only ones providing services there. And we've had to close our office. And so families have to travel now to get services. And there's so many different programs that we have that are not just what we've been talking about, child abuse and neglect. We also help women, most likely, start up a child care center in their home. So we're helping the economy that way. We help them through the licensing regulations with the health department, and we get them an income. They want to stay at home, they want to watch their own children, but they also want an income. So here's their small business that they have from their home.
Right.
We have 100 homes in a year that we're helping license, and we're monitoring every month. So that's something that we do that helps children in the long run, but it also helps young women and older women actually who want to stay at home with their children and have a business and have an income.
Colleen, are you training these are you training the people that want to do this?
We have
with early
tons
childhood development.
Yes,
and
we
all
have
that?
tons of workshops. And here's something about the child care centers. Okay, I sent both of my children to an excellent child care center. But in so many child care centers, they're like a babysitting business. You make minimum wage, you don't work the best hours under the best conditions. And what we have been striving to do is to make that a profession. You're a teacher, because 0 to 5, during that time period, 90% of a child's brain is developed. So you figured that's your time frame right there. It doesn't start at kindergarten at 5 years old, which we've thought for years. And if a child is not nurtured and stimulated, his brain or her brain grows 20 to 30% less than the
It's
normal
literally
child.
a physical kind of.
It is indeed.
So that's
inaction
a
or-
critical time. It used to be, they just played outside and they played in the big room and they had all this fun.
And
but
we
now,
read, my parents probably read to me more than, I mean, that was a thing,
Right.
all those things that used to be the stimulus, I think.
yeah,
That's
and
how
so
I
now
first came to Child and Family Resources is through child care referral, and went to a family child care home, and it was, it really was a very, very good experience. It made me want to be involved with the organization
Right.
for over a long period of time.
And one of our schools that we're associated with, it's called Tucson Nursery School. It's in Pueblo Gardens, and it's a low-income area. And the director said the other day, we want our children here who come from, at-risk families, a lot of low-income families, to have the same quality child care the children in the foothills, the children on the northwest side have, because they deserve that. And it is true. And we can provide that by working with those teachers. They come to our workshops, they learn a little bit about how there's different ways of learning and how to treat children differently, how to get down on the floor with them and interact with them. And back, when we were growing up, we just didn't have that.
No,
And
no.
we're finding there's a huge difference.
But you know what I think is very, very important to say? It's not that we don't know what to do. We know what makes a good child care center. We know what makes a good home for a child. We know what good health care looks like. We just don't do it. That we have made a statewide choice not to put money into those things. And people think a budget, it's a list of numbers. A budget is a moral document. It says, what do we care about and in what order do we care about those things? So when we see a budget that cuts everything that has to do with health care, everything that has to do with child care, everything that has to do with the disabled, we are saying those are our lowest priorities.
Well, and as Colleen said, the face. There is, you said it's not just a figure, it's a face. And I think hopefully, if one thing, this horrible economic crisis, it has put the face for us, our neighbor's face, our own face, a friend's face.
Yeah, absolutely.
And you think we were just talking about this, and I thought of this. Raytheon right now is hiring hundreds of engineers. Their business is booming. So they're getting people from out of state because we don't have enough engineers in Arizona. So if you came to Arizona, let's say from California, and you started to see the headlines that what are our priorities? Are they children? Obviously not. Are they families? No. Is it education? No. You know, if you start to look at that, we want to bring businesses here to build up our economy. We can't do it on the backs of children. We cannot make these cuts on the backs of these children and families.
Well, you know, as Penelope just said, what was the region, you know, 3 or 4 years, the great regional council that spoke to so many issues, you know, getting together as a council, what was it? Do you remember? Southern, oh my gosh, I hate, don't pay attention to me. But it was part of the thing is businesses, Colleen hit the nail on the head.
Right.
You know, Tucson's a beautiful place to live. The company is
But
wonderful.
that's not good enough.
Yeah.
But
and if you come as a single person, maybe that's great. But if you bring a family or want to raise a family or want to stay here for a long time, and you're looking at what we value in our community, that's what's very unfortunate.
Yeah.
And you know, Arizonans are not idiots. We know that if you want services, you have to pay for them. And our legislature has not served us well in that. We've done a lot of polling. People are willing to pay higher taxes for services that benefit children, that benefit families, that benefit education. And our legislature has vowed not to raise taxes, and in fact has eroded our tax base so much that we now cannot afford the services that Arizonans say they want.
Right.
And I think it's really a delusion to think we can just generate money out of nowhere or generate services. Every family knows if you want something, you have to work, you have to pay for it. It doesn't just come out of the sky.
Right. So specifically, what tightening, what things have you seen getting worse?
Getting worse and worse.
During this particular time, you know, are the services to children diminishing, and if so,
yeah.
which ones?
Well,
And
just the healthy families that I talked about, where we go in and you know work with the families for 5 years, they were cut 75%. So we went from 550 families that we helped to less than 100.
And statewide, that means about 3,500 families are not getting services that were 2 weeks ago.
So right there, and then also our in-home programs where there are issues. There may be some abuse, neglect, some substance abuse. Dad is in jail, you know, that kind of thing. Well, we're there to take care of those kids. You know, life still goes on for those children. They still have to go to school every day. So we're there to protect them, and that was cut for us. We used to have about 12 people who worked in that program. Just in the Tucson office, we have 1.
what happens? What happens to the children, Colleen?
Well, you know what? It's the worst thing when our staff had to go out there and say to these families they've been working with, I'm really sorry, we lost our funding, I'm losing my job. And I don't know what to tell you because we have no idea if they're ever going to bring back these programs.
And honestly, I mean, one hates to say it, but we expect to see children die. There are no services, there is nowhere for them to go, there is inadequate investigation when there is something going wrong. We just think it's a matter of time.
Is there anything citizens can do to help?
Yeah, there is. Okay. Good. And that's the good news.
Let's give you the top 10 list.
The good
Top
news
10 list.
is I think the most important thing citizens can do today is write to Governor Brewer and say, accept every cent of stimulus money we can and use that stimulus money to benefit the children and families of Arizona. Then they need to write to their legislators as well. And here in Arizona, we have a fairly receptive legislative delegation.
Our Southern Arizona.
Our Southern, but not uniformly, I have to say. Some of them, this is not their priority. They each need to hear what the impacts of these cuts are and what the value of the programs has been. So citizens can do that. It's very easy. And they can go right on our website. We have a link that'll bring them to find out who their own legislator is. It's very simple. And so we really urge people to do that. When they say write your legislator, it matters. One legislator once said to me, I got a flurry of mail, a huge storm of mail on this topic. And I said, I imagined like thousands of letters. He said, yeah, I got 8 letters. And I thought, if 8 is a storm, we can make a blizzard.
Right, right.
If people will just write.
Right. So let's take a look. I want to make sure that we have that website up here again. So if we can get the Children's Action Alliance, and as Penelope just said, go to the website azchildren.org. That's azchildren.org, and you can learn what the organization is doing, but you can also, it's a direct link to how you can contact your local state legislators and the governor. What would you like people to do? What would help?
You know, here's something that there were 3 Democratic lawmakers, 2 in Southern Arizona and 1 in Phoenix, who wanted me to help them put together news conferences. This was about 3-4 weeks ago. And they wanted to talk to the press. They wanted to get the information out. What we didn't expect was that the word spread across the state, and hundreds upon hundreds of families showed up and rallied. And that rally reverberated back to the state capitol. And all of a sudden, we get calls from lawmakers, our local lawmakers, saying, can you explain what they're complaining about? Because, you know, we're told some of these lawmakers, and they have admitted to us, that they signed this package not realizing the impact. And we actually had one of our lawmakers sit with our staff in Graham County. And he sat down and he said, and he has a child who has a developmental disability. And he said, I never realized this. I mean, basically, he cut services for his own child. And not until that happened did he really realize it. They say, I was not at the meeting, they say he cried. And he said, I'm really sorry. This was not what was intended. We need to fix this.
And one thing that's very, very important is that some of our legislators had been blaming the Department of Economic Security. They were saying they cut the most urgent things, the things that people need. They had no choice. That is putting the blame in the wrong place. And legislators, I think, who may not have known what they were doing, or may have known but now realize that Arizonans are not happy, are trying to find another scapegoat. But honestly, it's the legislature's decision what the budget looks like. They create it, they pass it, and if they vote for it, that's what we live with.
Wow, right. Is there, what happens? I mean, you know, Colleen just described, which must have been a heart-wrenching situation, going to families and saying, I'm sorry I can't be here anymore for you. There's no more help. We can't help you. Are there any other kinds of consequences that you're seeing or hearing about, Penelope?
I think we'll be hearing about them. It's only been 2 weeks. So it's a little hard to say that we've actually seen the consequences
right.
yet.
But you really thought we could be seeing the
I
death?
think we'll see children. I think we'll see children hurt. I think we'll see children die. I think we'll see a vast number of people unemployed and not able to go to their jobs because they don't have child care. And I think as the reverberations from no preventative measures, we'll see more kids, kids having kids. We'll see more sick children getting sicker and using emergency rooms instead of primary care. So all the things that we know happen when you don't do prevention, I think will start rolling in the next probably month or 2.
And what we're hoping to do is track that as best we can. It's very difficult to track, but if we can prove to lawmakers, these are the consequences. You did this is what you voted for, this is what you got.
Yeah.
And it'll
That
take us
direct
some
link
time. It'll take us some time, but that is definitely what we need to do. And when you were talking about consequences, I can tell you about a young woman who was in a domestic violence situation. She broke free. It took her a long time with the help of a therapist from our agency, as well as a staff member who's a family support specialist. She was so proud of herself. She had a baby, and finally that baby was not going to live a violent life that the 2 siblings had. She was so proud of herself. Then the therapist comes to her and says, this is our last visit. I've been laid off. Our program has been cut. And she was in our lobby. I cannot begin to tell you how many days when I walked by, I saw her and she thought, if I could just see her for one more minute. That poor woman.
Gosh.
And she went to the Capitol and she met with Al Melvin. And she sat down and told her story and said, I want you to know what you voted for. And she was very brazen, but she felt satisfied that he understood.
It took a lot of courage, didn't it?
It did, and here's
It
this
does.
woman who's just been so fragile, and she got that strength, and she went up twice to talk to people.
Well, I think the message that both of you are giving us is one of, the responsibility is ours. The democracy is ours. The vote is ours. The responsibility to know what's happening is
exactly.
ours.
And also remember, next time you go to the polls, remember who voted for what and who you want to represent you and who represents your values, because so many times people don't vote or they vote, they don't really investigate the candidates, they don't go to debates that are put on by Children's Action Alliance. And that's really what you need to do, is be an advocate for your city.
Right, right.
One of the things we do most election years is we put out a document called Who's for Kids and Who's Just Kidding. And we say, questions to ask. And then what kinds of answers should you expect? Not just, do you like kids? And you say, well, who says no? But how will you make sure that kids have childcare? How will you make sure that they have health care? And make people make commitments to programs and to funding.
Do you think there's a way to, is there some deadlines here, you all, for the upcoming, the upcoming fiscal budget that the legislature is working on?
Now's the deadline.
Now,
because
they're operating they'd have to have it
June
31st, right? Or
right, and they hope to be done before April 15th.
Having it all ironed out by April 15th.
But, they always say they hope this, they hope that. Maybe they will, maybe they won't, but now's the time to be writing these letters.
All right, all right. So once again, real fast, let's get up both those websites. I think Colleen and I talked through her, so we didn't.
Oh, that's okay.
It was there, Colleen, but I didn't get a chance to.
But you can contact us anytime. If you go on our website, we have plenty of programs you can investigate.
Okay, and on here on the Children's Action Alliance, contact your legislator, the governor, go to azchildren.org, and it walks you through how to get in touch with your legislator. And then again, Child and Family Resources, a long-time fabulous organization here in Tucson. And the website is childfamilyresources.org.
That's it.
All right. And we only have 30 seconds. The honor, Colleen. I get that.
Well, I thank you for the time, first of all, Vicki. And you know what? I just have to tell people that they need to go out and make a difference. They need to have a voice. And I saw somebody the other day who said, you are one catastrophe, one accident, one illness away from being in some of these situations. Right. And just think of that.
Right.
Your time may be up.
That's right. And we do all know this. So it, as we always say, it's not a privilege, it's a right and a privilege to vote, and we need to exercise it and be our neighbor's keeper. Thanks. Thanks, guys.
Thanks, Vicki.
Thanks, Vicki.
That was probably the fastest half hour.
That was